Hello everyone! Welcome again to my YouTube channel. Nandito na naman yung breastfeeding and lactation consultant ninyo. It's morning time dito sa Canada ngayon and I'm very early dahil I have some questions na i-address ko ngayon and some comments as well na isi-share ko sa inyo kung ano yung magandang gagawin natin when it comes to bottle feeding, when it comes to breastfeeding. At may mention ko lang, I want to make videos na mapapakinabangan sa mga nanay who have babies, na younger babies, older babies. Kaya if you have specific questions regarding kung ilang months na yung baby nyo, ano yung mga changes na mga expectation na dapat yung paghandaan, because there are so many new moms privately message me na nasa-shock sila after maybe 5 months, 6 months, or 9 months, nagbabago yung behavior ni baby, nagkakaroon sila ng problema, either bottle feeding or breastfeeding. So, if you have those problems na nagkakaroon ng changes yung feeding nyo, either breastfeeding kayo or bottle feeding kayo, message me, let me know para maiga-guide ko kayo kung anong dapat yung gawin bago kayo maging may stress or maging frustrated sa mga behavior ng babies nyo. So, one thing that I want to address right now is yung may nagtanong sa akin dito about pumping and nipple confusion. So, I don't know if you have watched my video last year about nipple confusion. Dahil itong term na to, ito na yung pinakalumang term na ginagamit ng mga healthcare providers dyan sa atin. Dahil, alam nyo naman, kalimitan talaga sa mga healthcare providers natin dyan, sometimes they're so behind from the new research, sa mga resources. Kami dito sa Western countries, we are very fortunate na almost every month, alam namin kung ano may mga latest research. Kaya we have to adapt the new research. We have to learn the new research. Kaya yun ang advantage namin dito na nasa ibang bansa kami. Kaya ko isi-share sa inyo para alam nyo kung ano yung bago ngayon, bago na ginagamit talaga namin sa aming practice when it comes to nursing, when it comes to lactation consultation. So, again, itong video na to ay inaalay ko sa mga nanay na nagba-bottle feed o sa mga nanay na planning to bottle feed dahil babalik kayo sa work. So, this is the so-called understanding kung ano ba talaga yung tinatawag na nipple confusion versus nipple preference. Kasi doon kayo nako-confuse eh. Kasi yun ang ginagamit lagi ng mga halos kalimitang mga healthcare providers na, oh, mako-confuse si baby, oh, wag kayong ganun. So, this is it, mga nanay. Ito na yung itatama natin yung mali, okay? So, when you think about planning na pagdating ng 6 months, babalik ka sa work, nawo-worry ka ngayon because you're breastfeeding now, maybe 4 months ka pa, and then you're breastfeeding, and then nawo-worry ka. Baka pagdating ng 6 months, magba-bottle feed ka, hindi na didede si baby sa'yo when you come home dahil nga tinatawag nilang nipple confusion. Sa murang edad ng bata, based po ito sa research, hindi ito based ng utak ko, okay? This is based on research that we have used this one in our practice. Sa murang edad ng bata, 6 months to 9 months, wala pa silang ability na doon sa brain development nila na may tinatawag na confusion. Wala pa. Mararanasan lang ito ng growth development ng bata. Pag ang bata ay about 2 to 3 years old, medyo may alam na ng konti. Pero when it comes to newborn, when it comes to infants from 0 to 12 months, hindi po matatawag natin na maninipple confuse yung bata. Kaya i-correct po natin, if you're a healthcare provider right now, midwife ka man, nurse ka man, doktor ka man, huwag nyo na pong gamitin yung sinasabing nipple confusion when it comes to bottle feeding. Hindi po yan kasama sa research na ngayon. Noon pa po yung sinauna na yun, okay? Ang term na po na ginagamit namin when it comes to practice dito sa Western country is nipple preference. Bakit? imagine ninyo, okay, I have my nipple here. I always demonstrate it to you sa mga nanay na talagang nagpaplanong magbabottle and then nawo-worry kayo, baka makakonfuse si baby. Depende sa nipple na gagamitin ninyo, okay? If I were you, let's say 4 months pa si baby ngayon, 5 months, siguro mga 8 months from now or 6 months from now, you going back to work. You really need to slowly train your baby para maging smooth yung transition ninyo from your breast to the bottle at mawawala po yung tinatawag na preference. Okay? Yung nipple preference po kasi ganitong nangyayari. Could you imagine for 6 months, let's say for 6 months na nagbe-breastfeed ka, yung texture ng tawag nito, ng nipple mo, yung texture ng nipple mo, yun talaga ang parang preferred texture ni baby for that long. Yung 6 months na yun. Could you imagine 6 months niya yun na napifeel, na nalasahan. So, feel niya yun. Yun yung preference niya for that long. Ngayon, babaguhin mo within suddenly mga 6 months or a month bago ka you go back to work. Talagang, minsan yung ibang baby masya-shock. Minsan yung ibang baby, they kind of having difficulty adapting the new taste, the new texture. Imagine niyo ha, especially, hindi lahat ng nanay ka-afford bibili ng soft silicone na nipple. Ang kalimitang nabibili sa mga mumurahing department store o mga tindahan is the rubber nipple. Okay? Iba po yung silicone kumpara doon sa rubber. Okay? So, iba talaga yung texture pag sinabing silicone nipple, mas maano siya, malambot, parang nakakopy yung texture ng skin natin when it comes to silicone. Pero pag rubber po ang type ng nipple na binili nyo dahil hindi kaya ng bulsa, talaga pong mahihirapan kayo when it comes to transition. Kaya ngayon sasabihin nyo, nako-confuse kasi yung baby ngayon kasi ganito. Dapat tanggalin natin yung confusion kasi sa murang edad na baby, wala pang capability si baby na mako-confuse. Wala pa. Tayo nako-confuse tayo pero yung babies hindi. But they develop that nipple preference na kaugalian na nila since you gave birth. Yun na talaga yung napifeel ni baby, yung texture ng nipple mo. Kaya you have to find a way, if you want to really invest a really good silicone nipple, na it really resembles doon sa shape, sa size ng nipple mo. Ito'y sinasabi ko even before, ang term na nipple confusion, lalong nako-confuse yung mga nanay. Kaya hindi na tuloy sila motivated to continue kung ano man yung goal nila, maybe in 3 months or 6 months or 9 months, they're going for bottle. Kasi natatakot sila na hindi na babalik si baby sa nipple nila, okay? So again, when you're doing transition from your breast to the nipple, follow up ko lang ito, okay? Kailangan talagang umpisahan nyo even 2 months before. Kung may plano kayo when you're going back to work, or there's some incidences na kailangan nyo talagang i-wean off si baby sa breast, or half-half na lang ang gawin nyo. Again, when you go see your healthcare provider at humihingi kayo ng payo kung anong type ng formula na gagamitin nyo, you have to watch that video that I've created on what's the right formula for your baby. Ang importante talaga that the use of bottle when it comes to bottle feeding sa baby nyo, i-consider nyo talaga ang quality ng bottle at quality ng nipple na binili nyo at saka yung mga sizes. And watch that video again if you haven't watched that video. So, uulitin ko po, yung nipple confusion ay kailangan sanang i-erase na natin yan when it comes to teaching. Okay? Ang ipapaintindi ko sa inyo yung tinatawag na nipple preference. That's what you need to understand. Why the baby refused to breastfeed again when you're using the bottle. They're not confused. They just have the preference. That's why we have to remove the so-called nipple preference. nipple confusion, although it's in the book now, although nababasa niyo sa mga internet, but based on research, it is not true that the baby feel confused with the bottle. It's just the nipple preference. Again, kung may problema pa kayo when it comes to transition, dahil alam ko marami kayong nagme-message sa akin na paano ba ang gawin, sinunod namin yung lecture mo about, video mo about how to do transition. Iba't iba po kasi ang babies. There are babies that you can train the baby effectively, mabilis, to come to transition. May mga babies talaga na kahit pilitin mo, you're gonna fight with your baby at hindi pa rin mangyayari. So don't fight with your baby. Yan ang pinaka number 1 rule ko kung I'm teaching. Do not fight with your baby. The minute you fight with your baby, both kayo nai-stress, doon na. Yung negative energy mo, you pass it on to your baby. Anong nangyayari? Si baby iyak ng iyak, ikaw mainit ang ulo. So, anong nangyayari? Lalong wala ka tuloy gatas. Lalo tuloy nadidepress ka, lalo tuloy nagdi-decrease yung milk mo. So, it's affecting you and it's affecting your baby. So, what's the best way to do it? Try to calm down. Do not fight with your baby. Do something else. Other ways on how this baby can satisfy. Let's say the baby ayaw talagang dumede sa breast mo. Ayaw talaga no matter what you do. Or ayaw talaga sa bote na talagang you have the most expensive silicone nipple, you have the perfect model. Ayaw na ayaw talaga. So you know what you can do? Ito din-demonstrate ko noon sa ibang mga videos. So put your milk in here. Put your milk in here or put the formula or artificial milk in here. Put this one dito sa dibdib ni baby. So if the baby is laying there like that, cry and cry, let the baby cry. It's okay. As long as alam mong the baby is not in pain, si baby is not dehydrated, just let the baby, it's okay to cry. And then when the baby comes down a little bit, medyo na calm down as baby a little bit, let the baby hold this, okay? And just play it around, you know? Gaganin niyo lang, oh? Just tap it around the nipple. You're just like playing with your baby. Yun ang gawin niyo dahil the minute you share that negative emotions that you have, frustrated ka, stress ka, alam kong nakaka-stress. I've been there. Pero never let that stress control yourself. Kasi pag ang stress na nagko-control sa'yo, then it's just gonna make it worse. So mabuti pa, try to self-regulate yourself. You have to have self-control. Dahil pag wala kang self-control at paiiralin mo yung stress mo, frustration mo, lalong maapektuhan yung milk supply mo, lalong maapektuhan the way how you take care of your baby. Kasi galit ka eh, frustrated ka eh. So it's better, just take a deep breath. Pasa mo muna ka, Mr. si baby. Go outside, take a fresh air. Siguro mga 5 to 10 minutes. Drink coffee or whatever makes you feel good. And then, go back and do it again. Mga moms, do not give up so easily. Kasi nahihirapan din itong baby niyo. Could you imagine? Kung feel niyo nahihirapan kayo, how much more itong baby niyo na pinapahirapan ninyo doing the transition from breast to bottle or from bottle to breast. So, pinapahirapan yung sarili mo, pinapahirapan pa rin si baby. So, you need to understand, hindi po biro ang mag-adapt another preference when it comes to transition. Okay? So, yun ang intindihin nyo na hindi po magic. Ito yung sinasabi ko. When I teach, you have to be very patient. Patient ang kailangan nyo. Because pag wala kayong pasensya, kahit 1 week ko niyang, even though you're doing it for 1 week and there's no improvement, do not give up. You know what? There are some of my patients na ubamot ng 2 weeks or 3 weeks. So, hang in there. Watch more videos from me. Stay subscribed. Like this video, share this video para marami kayong matutulungan ng mga nanay. And we share the love, we share the knowledge dahil pag wala kayong lactation consultant ngayon, katulad kong nagtuturo sa inyo ngayon, sinong magtuturo sa inyo? So you need to share this para marami kayong matutulungang mga nanay na walang tulog, na i-stress. Bye for now. See you. More videos to come.